Good evening and welcome to the Broward Health Foundation Tribute to Healthcare Heroes, presented by Skanska. I'm your host, Lori Jennings, and I'm delighted to be with you as we honor the incredible healthcare heroes at Broward Health. Tonight is all about celebrating the kindness, compassion, and perseverance our healthcare workers have shown throughout the COVID-19 pandemic. We are going to talk with healthcare workers and hospital leadership, visit with some remarkable patients, hear words of appreciation from special guests, and debut an original song written especially for our healthcare heroes. We also have some breaking news. Through the support of sponsors, tonight's program has already raised more than $200,000, and that all goes toward the Broward Health Foundation COVID-19 Relief Fund. Now that's an accomplishment we get to toast tonight. As the coronavirus gripped our community in 2020, the staff of the Broward Health System sprang into action, swiftly reconfiguring their infrastructures to stretch capacity and accommodate potential COVID patients. Procurement went scrambling for PPE supplies to keep their workers safe.
Not wearing a mask, it makes me mad.
The workers pressed on tirelessly and courageously through the unknowns of a worldwide pandemic, inspiring us all. It is during moments of hardship that the strength of the human spirit prevails. Tonight, we salute the people and the courageous souls behind the masks.
Thank you, everybody, for being so great.
Welcome, everyone. I'm excited to introduce our first guest. Most of you already know him, and for those who don't, let me fill you in. Alan Goldsmith is Executive Vice President, Chief Operating Officer of Broward Health, where he's a strategic decision maker and visionary leader. Alan, welcome.
Thank you for having me.
We are masked up, safe, ready to talk. Take us back to when the first word came of this incredible virus and how Broward Health responded.
Well, I remember the day I had one of my employees ran into my office and said, I'm reading about this pandemic. We need to start preparing. And we haven't had a pandemic since 1918 in this country. So we went into our files and we got the pandemic plan and we dusted it off because obviously we haven't looked at it for a long time, and we got our executives together and we really started to look at what would happen if this really started to go into a full-fledged pandemic. The first thing that the pandemic plan said was to get PPEs to ensure that you have enough to support your staff. So right away, we called up our distributor and we ordered additional PPEs for our staff in case it happened. At that time, it was January and February, and we really didn't know if we were going to need it, but we wanted to ensure that we would be prepared for our staff. March 12th is sort of like our doomsday when we sort of went into full-fledged pandemic mode, and what we did, although it was new, we felt that we could be with our team. And so we started to really rely on our lab people. I know more about the lab now than I've ever known in my entire career. I know more about testing and lab analyzers and what we need and supplies. We had to have warehouses. We needed to think, what are we gonna do to ensure that first and foremost that our employees were safe and felt comfortable to come to work. And then second, what are we going to do to ensure the best quality of care that we expect to give at Broward Health? So we had our plan together, and then it was just an execution to make sure that we were the best at what we did.
So that pandemic plan from years ago, probably decades ago, was a place to start.
Yeah.
But do you feel like, in a way, you had to just throw it out the window and start again? Did you have to react in so many different ways?
When we first started, we were seeing the scenes out of Italy, and that just broke my heart to see the people in Italy and the patients in those hospital rooms, and that's when we really started to get scared. And we just had to learn. We had to come together as a group, and we needed to listen to each other and listen to their ideas and how we were really going to get through this as a team. So
thinking back, there had to have been a day that was just the lowest point of it all. I mean, was there a day that you literally could barely stand? I mean, it was just so emotional or so trying.
It was mid-July, and back in July we had that really big spike in Florida, and we had 270 patients in our hospitals. Staffing was very tight, and it just seemed like, God, I don't know how long we're going to be able to do this. And the nurses were emotional, and some of them haven't seen their family members because they were living in hotels. It was just a tough day, but when I look back on this as a leader, and what I really realized is that the teamwork and was really just made me proud, and everyone that was doing extra jobs. It was really an all hands on deck response, and that's something that makes me really proud of, that our team came together and did that as a group.
And you must feel all the time the emotional toll that this takes on your employees. How do you encourage them to take care of themselves?
So, we are constantly talking about that on a daily basis with my executive team, and how can we provide a work atmosphere where, one, they feel safe, number two, they feel like they're not overworked and they're not fatigued, and so what we've really just done is we've asked our nursing managers to round on a daily basis to really be compassionate and caring and understanding, and just talk to them and just have compassion.
And Alan, you must be so proud of all of your CEOs of each of the hospitals and what they've achieved. It has been incredible. We got a chance to sit down with each of them recently and get their thoughts on the challenges of the past year. Let's take a look.
The COVID-19 pandemic pushed healthcare to its limits, but the extreme demands offered opportunities to learn valuable lessons about how to best support employees. We sat down with the leaders on the front lines for a look back in their own words.
March of 2020, I'll never forget it. It's when we started to see our first patients come to the emergency department and be admitted.
We were looking at Italy and New York and seeing what they were going through, counting the days when we were expecting for the same to occur here in South Florida.
And that's really when life changed for us here and for our community. We started to see patients coming in and influxes of sick patients.
It was scary. There were days when I thought, I don't know how I'm going to get through this. Our ICU was full, and we had an older area of the hospital that used to be a peds area, and we opened that up as an ICU.
We're licensed for 16 ICU beds, and I think at the time we had over 30 patients in the ICU.
We now had employees that were scared. These are real emotions, worried about what the risk levels could be, their family members. So as a leader, how do you help people overcome these fears in order to give the patients really the care that they needed?
This was different because it was a virus and we didn't know how to treat it. We didn't know anything about it. We had to convert our patient rooms to negative pressure rooms. So that was a big part of this planning.
I will tell you that our team created a 25-bed intensive care unit overnight so that we could separate patients and not have our healthy patients mixed in the same environment. We also were able to open about 9 clinical trials, and there wasn't a playbook on how to take care of these patients, but it was really the implementation of those advanced clinical trials that really helped change the outcomes for our patients.
As a leader, what we learned is, one, be visible, be available. We needed to round in our hospitals, show them that we're in this together, and I think that was a common focus throughout this.
One of my colleagues said to me, when you're rounding, what do you see? Like, what are you thinking? I said, I see fearlessness. I see these nurses working in these units. It looks like a war zone. We were changing policies and procedures by the hour. We followed the CDC guidelines, and they were changing, so we were adapting as we went along.
There were a lot of days, especially when you were in that COVID ICU. Those doctors and nurses, respiratory therapists, pharmacists, they were so tired. You would watch them go in and try to resuscitate patients, and when they weren't successful at that, you could just feel the weight of the world. There were many days that I went in my office, I shut the door, and it would make me emotional. But I think that's just the human part of what we do.
We were worried about the patients coming in. We were worried about the families. So we had to adapt to how are we going to communicate.
There was innovation almost daily. In order to reduce the need to go in every time, we, as a hospital and as a system, bought numerous iPads, put them on stands, and it allowed us to place those in the patient room so the nurse and/or doctor didn't always have to go in the room every single time. They could have a face-to-face conversation with the patient, and we were also able to carry that on to family members.
We put together a task force, so I brought together people from all different areas, and it was a well-being task force. I wanted to really understand how we could better support and help eliminate some of the fatigue and burnout they were feeling.
We really tried our best to make sure that everybody was in a good state of mind. We created serenity places where our staff members could go and hear relaxing music and to sit in quiet areas and have some time to reflect. You know, we had individuals here from our EAP program as well to, to help lend an extra hand and to have a conversation with our staff if they needed it.
There were some days I was really overwhelmed and I just wanted to cry, but it made me appreciate the staff. It made me understand how hard they work and how dedicated they are.
We had physicians and staff members who had become COVID positive, and they were the first ones out there to donate their convalescent plasma. I mean, it's just truly amazing to see that really during this time where everyone's exhausted, they just want to give back to the community, and I think it speaks volumes to the people we have here.
The passion that they have and the care and the love that they have for our patients is unbelievable. And to see their family members outside when they would be greeted was so emotional for all of us because we knew the hard work was paying off.
I do want to thank our employees, our medical staff, and the first responders. It's been an incredible year, a challenging year, one that we never thought we would face in our lifetime, but more importantly, we came together when our community needed us most and delivered.
People just jumped in to help wherever they could, to support one another and to care for our patients and families. It was just one big team, and we have certainly become stronger, and I'm just so incredibly proud of each of them and their contributions to our community.
From the bottom of my heart, I thank you for the work that you have done, for your adaptability, your resilience, and the care that you continue to provide our patients. I can never tell you how great I think you are and how proud I am to be your leader.
If I could say anything to my team, I'm so proud of them. I'm humbled to have the opportunity to work side by side with them. They are the most fantastic individuals that you'll ever meet. It was never about them, it was about what they can do to help others.
It's always a humbling experience to see our healthcare professionals' passion and care for others. This year more than ever, we saw firsthand the dedication of our frontline workers as they bravely faced the COVID-19 pandemic head-on. That's why Skanska is a proud sponsor of Broward Health's inaugural Tribute to Healthcare Heroes event. For Skanska, it's an honor to continue to support our healthcare workers and staff and recognize them for their commitment to bettering our communities.
What an incredible team of leaders here at Broward Health. Alan, you must be so proud. You've all been through so much. It's just been such an emotional last year, but the passion comes from each one of those CEOs in leading this and trying to be there for everyone. What is next now? What does the future hold?
So 2020, I would say, was the most difficult year in most people's lives. And 2021 is going to be difficult, but there is some light at the end of the tunnel. And I'm going to tell you why I think that. We have a vaccine site that we vaccinate about 1,000 people a day at. And I personally work it every day for an hour. And I go there and I talk to all the people that just got their vaccine, and we talk, and they're excited and they're smiling. We're almost there, and we just need some time. People need to continue to be socially distanced and do their part as a community so that we can keep everybody safe, so we can get the vaccines in people's arms and we can get people safe again.
You have thousands of employees, and you have a chance now to really talk to them personally. What would you like to say to them?
I am in absolute awe of the passion in healthcare that you've given over the last year. I just want to thank you so much, and I will continue to do everything in my power to continue to support you. Thank you so much.
I'm sure they would say the same to you, and for your tremendous leadership and being there in person every step of the way. Alan, thank you so much. And coming up, we are going to sit down with some of the leaders at the Broward Health Foundation. But first, let's take a look at some especially memorable moments from the past year.
The kind of symptoms that I had was loss of my taste and also the shortness of breath. I couldn't even get at least 2 to 3 words out without losing my breath. I couldn't walk far.
I got the first symptom on December 3rd. It was fever, just starting to get a headache, the body aches, they're starting to set in. At that point, I just isolated myself from my wife and my kids in our guest room.
I'll be the first to admit I was one of the ones who thought it was fake, because I went from feeling good like this today to feeling funny the next day. Made a phone call to my cousin. He panicked and he called the 911. They rushed me to the emergency room and we went from there.
You read about stories where patients are going to the hospital too late, and when they get there, their oxygen level is too low. And so I knew that that was the one critical parameter I need to be monitoring. Combined with increasing cough, I was like, I need to head into the emergency room.
I was admitted. The feeling that I had was very scary because I really thought that I was going to be living my last couple seconds due to the way I was feeling. They had me on the oxygen machine the whole time I was in the hospital.
I was just exhausted, physically exhausted. In my room, I was staying, in touch with my family through Zoom calls. My daughter's birthday was coming up, so, you got to know some of the staff. Some of them knew that her birthday was coming up.
My dad, he was calling me about 4 or 5 o'clock in the morning just to hear my voice. I was happy about that because I felt like, people was actually thinking about me, loving me. And it motivated me to get better and not think about it at all, because I didn't let it take over my mind as far as, oh, I have COVID. Okay, now I'm scared. Yes, I was scared, but I had to put it in God's hands and I had to do my part about, staying strong.
During the time in the hospital, I was alone. The hospital staff really helped me feel like I was at home, and it was so nice to have that person that you could relate to or you could see every day, and have that similar connection, or you could continue a conversation that you left off from the previous day. So that was great to have.
The release day was I'll say the best day of my life, because that's when I finally realized my life was saved. My dad was the first person I called, and he shot straight out there. He was waiting outside for at least 2 hours. So when we got out the elevator, I see everyone just cheering, and I started to get emotional. Wow, this all for myself, and this all for all those who survived the COVID. And at that time, I didn't want to let go of my dad because I was happy to get out the hospital. And he just said, I love you. And it was definitely emotional for me at that moment. It was emotional for me to watch it as well, but I could watch it with a smile on my face.
I was in the hospital then for 8 days and was discharged on my daughter's birthday. So it's kind of like a birthday present for her that I was able to be released on that day.
Well, I definitely would like to thank the whole staff, from the lobby to the nurses to managers, supervisors, everyone in that hospital. I thank them so much.
I'm extremely humbled by the fact that there's that kind of care available. They're putting themselves out there and exposing themselves to people who have the virus. So I'm extremely thankful for everybody who is putting their lives at risk, putting their family lives at risk, just to help all the patients with coronavirus out there.
Hello, I'm Larry Blackburn, Vice President, Florida Healthcare Director for Turner Construction. We at Turner Construction wish to extend our gratitude and appreciation to all of the Broward healthcare workers and staff. You are the true heroes and have been before, during, and well beyond this COVID pandemic. We thank you for everything you do for all of us. Keep up the great work.
Sean Thornton from the Florida Panthers, Broward Health Frontline Workers. I just want to say thank you so much for all your hard work, all your dedication, all your sacrifice over these last 10, 12 months. I can't imagine how tough it's been and how hard you've been pushed to the brink, but I want to let you know that us here at the Panthers really appreciate everything you've been doing. Thank you.
Welcome back. I'm here with Bob Birdsong, Chair of the Board at the Broward Health Foundation, and Bill Diggs, the Foundation's President. Gentlemen, welcome.
Thank you very much.
Yeah, good to see you, Lori. Thank you.
Oh, it's good to see you. Give us a general sense, Bill, an overview of what the Foundation is and has become because of COVID.
Well, our mission is very simple. We are the organization that's here to meet the unmet need of our hospitals. As you know, we take care of about 2/3 of the indigent patients within the Broward County area, which is a very large group of folk. We do get some assistance from the state, but at the end of the day, we spend a massive amount of money helping those folk, and our job is to kind of help to balance that out.
And Bob, you were in the middle of planning your biggest fundraising event, your yearly event, and suddenly COVID.
It was our Black Tie Gala, and it is our premier fundraising event and for all 5 of our hospitals. And then we were blindsided by the sheer magnitude of this pandemic. We had to shift gears quickly, and we had to make sure that we helped out the facilities, the frontline workers, and the caretakers, and the people who are actually going to be helping other people through this situation.
And the sponsors, the support out there, did they hesitate because it was virtual?
The sponsors were amazing. I mean, we had people donating meals. We had sponsors for this event standing in line waiting to just take part and be a part of this whole thing and helping out in any way they can. It's been moving.
And Bill, you've already raised hundreds of thousands of dollars for specifically the COVID-19 Relief Fund.
Right.
Where will those dollars go?
Every year, as you know, like any other business, we try to make sure we manage our expenses. When this COVID thing hit, they tripled, quadrupled in so many different ways. From the buying of PPE equipment to the assistance that we would need to make sure that every day we were able to be safe, not just for the employees, but also for the patients. So our 5 hospitals have all seen, the expenses increase, and so these monies will go directly to them to help them to do, what needs to be done on a daily basis. And it's a big, big chore.
There are so many extras now because of COVID. Your nurses and doctors can't even go from one patient to the next without having all new gear.
And that's the hard thing. When our procurement department in the beginning of the year said, we know we're going to use X amount of masks and gowns and, the things that go on your feet just to be safe. And all of a sudden you look up and now you've got this COVID, right? So they're changing 5, 6, 7 times a day. We want to manage our dollars safely because, we got a lot to do. But it has really been the hardest thing for us to do. And that's just one component of it. The other component is we're buying these iPads just so the families who are outside of the facility can see their loved ones that are in the hospital. We all understand the science. There's that natural connection between a patient and a family that helps them to get well every day. And so for us, that was a big purchase that we had to make that was in nobody's line item. The foundation was fortunate enough with the help of the community, of which these funds will go to pick up that cost.
What has been the most emotionally draining day you've had in this crisis?
I will tell you to see the outpouring of support from the community, restaurants donating food, individuals setting up private funds to help out and marshaling their forces to get, and then just people in the community donating money to help feed and help take care of our healthcare workers. It's been inspiring. In these days of turmoil, it's great to see some people come together like this.
Bill, do you remember a moment, maybe you just were losing some hope and something really lifted you up?
We have a dentist in town, that we didn't realize how many masks that they might be using. He said, look, my son and I have got a business and we want to bring some masks to you guys, and it was one of the first donations that we got, and when he said some masks, we thought he was going to come with a box. He came with a van. And when he started bringing all the stuff out, I said, you're not even in this business. He said, this is my community. I got to do something. And we just realized that he is just one example of this community in Broward that exists. There's so many others that have come after him since that day. And we all know, and he knows, that this is a marathon. It's not a sprint.
Everybody stepped up. It's wonderful to see. And Bill, the actual money so far, I think it's up to $200,000 and beyond. That's
right?
Huge for a virtual event.
Right now, as large as this issue is, the outpouring of support has been as big, right? And don't get me wrong, I mean, you know, 200 grand is a very, very good start, but it's nowhere near, you know, what we need to continue to provide the quality of care that we want to.
How can someone make a donation specifically to the foundation if they want to support the COVID-19 Relief Fund?
We have this wonderful event, saluting healthcare heroes, and really we just need everybody to appreciate our frontline workers, show them we love them, show them that we know the sacrifice they've done, and if they can help in any way they can, that's what we need right now.
One of the great things about this is that it is an online campaign as well, you know, so you can go and you can text HERO 74121. And it's just that simple. I mean, we've got a way tonight that you can still go on and make your donation, because to be honest with you, we're going to need you. I wish I could say this thing's going to be over tomorrow, you know, but the bottom line is that we've got a long way to go to get out of the woods. Help us with that, and you know, and we can keep this thing going.
And Bob, what would you say to your healthcare heroes, speaking directly to them right now?
I just want to say we appreciate you. We appreciate your superhuman efforts. You haven't given up on the community, and the community hasn't given up on you. We understand what you've done for us, and we will continue to do for you.
And Bill, what would you say?
These people are definitely connected to the communities that they live in and that they work and they service these folk. So every day you find caring people. In the midst of all of this, it's been a shining example of what it takes to build real neighborhoods.
Beautiful.
Yeah.
Thank you both, gentlemen, for everything you're doing for the foundation and for your staff. And if you would like to help and support the COVID-19 Relief Fund, you can just text the word HERO, as Bill mentioned, to 74121. We'll have that number at the bottom of the screen all throughout the program for you. So don't go away. We will be back in just a moment.
Hello, everyone. Kyle Booth here, immediate past chairman for the Broward Health Foundation. Today we celebrate tribute to our heroes. Our heroes are the frontline workers, employees, and all the staff and healthcare workers at the Broward Health system. My family and I have moved here in 1976 and will always consider Broward County our home. We've leaned on Broward Health system in the past, our family has. This year, making a donation to tribute to our heroes was an easy check to write. Without funding for our local community to help our neighbors, to help those that don't have health care, to help us get through this pandemic, that's why we did this. We want to thank you. We say God bless. We love you, and looking forward to seeing everyone in the near future. Thank you very much, folks.
So along comes this dreaded virus, COVID-19. It has shaken us to our core. We no longer are able to sit next to strangers. We are no longer able to hug our loved ones. It has all changed us, perhaps even forever. It is almost all bleak. But in the midst of this, we have a hint of daylight. We are seeing the good in our fellow man and women, almost like never before. That goodness shines brightest amongst the frontline workers in the hospitals. They are our true heroes. So on tonight, I want to add my voice to those that are saying, thank you so much. Thank you so much to our healthcare workers. I have had my share of health issues, so I know your worth. This will soon pass, and as it does, your dedication to saving lives will forever be remembered.
Let's take a minute to acknowledge our Diamond sponsors for their generous support of this tribute.
Welcome back. We've all been spending a lot of time at home this past year and hopefully being safe so we don't increase the load on our hospitals. I had the opportunity to spend the day recently with some of our healthcare heroes who don't have that choice to stay home. They are right in the thick of it on the front lines.
While most of us were sheltering at home this past year, many unsung heroes have been out on the front lines since this pandemic began. All of them working tirelessly for the safety of our community. As of today, they are still out there, so we went to them.
Hi, I'm Lori. Nice
Ambulatory
to meet you.
care nurse manager Colleen Virgins has been managing the testing sites for Broward Health and has kept them prepared to set up wherever they are needed most. Today, I found her at the walk-up COVID testing site in Pompano Beach.
Colleen, since the very beginning, I mean, you had 2 testing sites, now you're down to 1. Have you been running all of this since day 1?
I have been part of the team that's been running it since day 1, yes. There were a couple of us that were core staff. Myself, I have another coworker, his name is Benny. He's an RN as well, so he would take one site, I would take the other, and yes, we've been out here since March.
How many tests do you think you've distributed?
We've done well over 50,000 tests by this point.
50,000. Does it come in waves?
It does. When we first started this, we had a site set up where we had double lines, meaning 2 going at the same time. 4 cars would be tested at the same time. And then as time went on, different hotspots popped up, different communities needed the service more, so the numbers would dwindle, and then we would relocate ourselves to the communities that needed service.
You have 2 kids at home.
I do.
What has been the most challenging part of going back and forth and back and forth?
Initially, it was just the unknown as to, what would the ramifications be for me as a healthcare provider in this environment. Would I get something? Would I bring it home? Would I know in time? So there was time in the beginning that we would go into certain hotspots and then I wouldn't see them for some time, maybe 30 days.
30 days?
Yes, about 30 days, especially when we went to some of the hotspots where we were working in an enclosed environment. Yeah, as a precaution for safety, I would ask the kids to stay with their dad. We would Skype, we would Zoom call, we would see each other every day in that respect.
Has it all come in waves?
It has come in waves. When this first started back in March, you can imagine the community was scared. We were scared. We had no idea what to expect. People were very scared. And since then, it's really settled down a lot. We've always had adequate supplies. We've always had adequate equipment. And so our team is secure as well.
Gets you emotional, doesn't it?
It does.
I can tell. What was one of the worst days that you remember?
Probably our second day. The first day, people were kind of in shock as to, this is going to be our new working environment. We had employees that, for no other reason, they were scared. They didn't want to get out of their car and report to work. And we're taxed with long lines. People in the cars were scared. They didn't want to open their windows. And it was a lot of just trying to reassure them we were safe. Our medical director stepped up and he would have a huddle with them every morning and talk about what we're doing to keep everybody safe and how the needs are for the community. And after a few days, everything settled down and just became a well-oiled machine. Everybody reported to work, everybody came on time, and the community has been served.
This whole event is about thanking our healthcare heroes. Have you just felt the love over and again?
The whole time. I mean, randomly, my son will text me, "I'm so proud of you to be my mom."
Oh, that gets you.
And I feel like it's really the team and not just me.
But they look to you.
Yeah, thank you.
Have you had anything with sons gets me, so I'm going to get to hear it too. But have you had to take someone aside and can you remember a moment when you had to really kind of carry somebody through this?
Sure. I go back to that second day I had an employee and she said, "I have a small child at home. I don't know why I'm here." And at the time it was so unsettled that none of us really knew where we were going with this. And it was just letting her know that we're here, we're going to do everything that we can, and we're just going to try to get through it. There was minimal interaction with the patients in the cars through the drive-through site, and we tried to keep it that way to minimize the exposure. But you could see them. They did not know what to do, where to go.
Tell me about a day when people just came and said thank you with so much love.
Every day.
Every day?
Every day. No matter how frightened they were or how nervous they were always thankful. And they are thankful. They want to do group prayers with us. They want to tell us how much they appreciate us from start to finish. The outpouring of support has literally been amazing.
So in some ways, you've seen some beautiful human spirit out there.
We have seen really the best in each other through this.
Well, thank you, Colleen.
You're welcome. Thank you.
Chief Procurement and Supply Chain Officer George Hernandez created a makeshift warehouse out of empty offices in an effort to stockpile supplies in anticipation of the unknown. It also filled up quickly with the thousands of donations from local and national companies.
This place is a maze. Do you really know every single box in this place?
Yes, I do. I do know everything that we have in our corporate stockpile. It makes me feel good that we have enough supplies to make sure that our healthcare heroes have what they need to take care of our patients and the community on a daily basis.
But you sensed somehow this was coming. You knew way ahead and started planning ahead.
In January 2020, when we first heard of the pandemic in Asia, we stopped building our corporate stockpile. We started working with distributors and manufacturers, making sure that we have the appropriate PPE and medical supplies to take care of our patients.
But it couldn't have been easy. People were running out all over the country.
Yes, our procurement and sourcing team worked around the clock.
So you've never run out. Your people weren't in garbage bags instead of
I'm
grates.
happy to say that Broward Health had what they need at all times since the beginning of the pandemic. From isolation gowns to surgical masks to respirators to hand sanitizers, we were very proud of the work that we have put into building this corporate stockpile to backfill the hospital inventories.
Pre-COVID, pre-January of 2020, what did this place look like?
This was just a small distribution center to our physician offices. So I will say that we only occupied 20% of this area.
And now it is, it's almost 100% full.
It's 100% full. We have supplies also at the facilities being stored because we run out of capacity here.
All these beautiful donations, you probably couldn't use them all. Were you able to help others?
Correct. We have our value analysis team and our clinical team vetting every product that was donated. So those products that did not meet qualifications to be used in a clinical setting, we donated those to non-for-profits within our county.
So it's really been a full circle of support.
Yes.
We try to put a nice face on it, but it's so foreign what everyone's been through, and you really are on the front lines. You would never expect to be on a COVID floor in your hospital. What was that like?
We never expected to have a COVID floor in our hospitals. We're always been using healthcare to have isolation rooms. But the toughest part, I will say, is just to see those clinical staff being so emotional and trying to save life and going above and beyond. It was so new to the physicians, so new to all of us, that we want to make sure we were doing the right thing and we were saving lives.
Has anything else in your career come close to this?
No. And I have over 21 years of healthcare experience in supply chain and never witnessed anything like this.
That you're weathering this storm somehow.
Yes.
Do you see a light at the end of the tunnel?
I do see the light at the end of the tunnel. I think with the vaccine, things will change. But from the supply chain perspective, the way that we handle logistics and forecasting and inventory of PPE, this have left a mark in all of us. So I don't see us getting away from a corporate stockpile. I think we need to be prepared at all times. This massive global disruption of supply chain have teach us that stockpiles are important to prevent and to mitigate any pandemic coming in the future. So we will continue making sure that we have enough supplies to backfill the hospitals as necessary.
I thank you.
Thank you.
I stopped by Broward Health North to visit James McCrae, an Army veteran still dedicated to serving his country. Only this time, it's in the ICU.
James, you came right out of the Iraq War for the Army into the medical field. You've been here 20 years. Has it felt like you're at war some days?
Yes, in the height of the COVID, it was like we were in combat zone. That's what it was like. The whole hospital was just like the floor. It was the uncertainty, the running around, and you put out one fire, then another fire starts. So, yeah, I would say it was the closest thing I've seen to combat since being in the Army.
Did you almost have flashbacks to being in Iraq?
A lot of times, that's exactly how I felt coming into work. How I felt like on a helicopter or on a C-130, about to jump in somewhere. It's a war up there, At certain points, the enemy was winning, so we have to come up with a different strategy to overcome this and to win this battle.
You were running several floors at one time. You were almost out of beds. What was that like?
It was very stressful, knowing that my ICU was full, and then the patients on my telemetry floor, needed to go to ICU, so we just had to buckle down. And every day I came in and I put in scrubs and went through it with the staff and kind of showed them what they had to do. At that time, we just had to maintain and keep the patient alive and safe as much as we can. And we were learning as we go. It was new. No one knew anything about COVID. And it was a lot of long days, long evenings, long nights of the uncertainty, So we did our best to try to keep them alive.
Do you think this brought out a whole different type of leader in you?
I used to always tell my assistant nurse managers, yes, we're stressed. Yes, we're afraid, but we cannot show that to the staff. If we show that to the staff, they're going to follow that. So, we had to swallow our,
your fears,
and just okay, sound confident and we'll work through this. I was a sergeant in the military, so I wouldn't ask you to do anything I wouldn't do. So every day I would come in, put my scrubs on, and go in the rooms with them. And we did it all as a team.
What do you think people outside of here just don't really get? Everybody thinks they have a sense of what's going on in these hospitals, but what don't they really understand?
First of all, I don't think they understand the level of stress that it has put nurses under all over the world, you might as well say. And to come to work every day, to deal with that every day for 12, 13, 14 hours is very, really taxing on the body. It's a lot because they get sick. You never know. It's a coin flip whether you're going to go home or not. I feel I have an excellent team in both units. They've just been rock steady. I could not have done this without them.
Well, you call them rock steady. Something tells me they would call you, James, very rock steady. Has that kind of stress every single day, has this changed you forever?
It made me realize how much, your family means to you. Not being able to see them. It really, really made me, love them even more.
Thank you for all you've done, James. Thank you.
Hello everyone, Jeff Fredericangeli, Fredericangeli Wealth Management. I just thought I'd take a moment to let you know that my team and I here at Fredericangeli Wealth Management couldn't be more honored to be a part of and a diamond sponsor at this year's Tribute to Healthcare Heroes event. There's never been more of an important time to support the hard work of these heroes on the front line of healthcare that I personally have worked with and had the experience of seeing how hard and how much they care for the people that they're tending to. And just want to thank you all and tell you to keep up the good work, and just know that folks like my team and I are here to support and are very, very much so proud of you. And we look forward to being a part of your success and your continued growth in the future. Please be well and be safe. Bye for now.
There's no way we survive this pandemic without you. Our essential workers, and especially you, have been so important to us that you have allowed us to live. You are the true heroes. On behalf of the Miami Dolphins, all of our players, staff, and even the community, we want to thank you. Thank you very much, because without you, we're not here. You're the hero.
Let's take a moment to acknowledge our platinum sponsors for their gifts of support to the Broward Health Foundation.
There were tears. We all wanted a hug. It was an emotional day, learning so much about these heroes' lives, their own families at home, and their sacrifice. I met a lot of people, but I wish I could have met a lot more and said thank you to every hero who's worked so tirelessly and selflessly throughout this pandemic. If you're watching tonight, thank you. There are so many heroes all across the Broward Health system. It's huge. So let's hear from a few more about how this past year has really affected them.
We're very proud to partner with the Broward Health Foundation and the virtual event that you're doing this evening, really a tribute to our healthcare heroes. We're very excited to recognize these healthcare heroes and the impact and really the selfless service that they've done during this COVID-19 global pandemic. You know, with the funds that are raised this evening, they will really have an opportunity to benefit so many people, and we're so excited to be a part of that. So from your Aramark team and from myself, again, thank you to the Broward Health Foundation for all that you're doing to really recognize these individuals. And again, we hope everybody has a terrific evening. Thank you again, and be safe.
My spiritual sense have gone up a lot. I sat and held many hands while people have passed away. I have one great lady that was older, so I used to feed her every meal. We'd put music on, and just that extra special time, it just made me feel like a better person and made me think, now I know why. Now I have a purpose again. I realize what I'm missing at my job.
I think the first 2-3 weeks was really frustrating. We were all kind of getting depressed. There were a lot of unknown things, right? We were prepared to take care of a certain number of patients, but with all these years of experience and everything, we really didn't know how sick these patients were going to be.
I was scared, definitely. I'll never forget being that scared in that moment, knowing that I had to go into the room, because at the end of the day, I go home to a family. The unknown was the scary part.
The pandemic is surreal. What really spiraled out of control was the inability to control our supplies that were coming from China or that were being manufactured in Italy. This was the one thing that shook the core because there was no ability to test for COVID-19. When you do your collection for COVID, it must be inserted into this viral transport media before you can even run the test on the analyzer. There was no more. Our manufacturer did not have any. So we reached out to the CDC, found out what their ingredients were for their viral transport media. I procured all of those ingredients. We started brewing it in-house, and as I said to my team, we're scientists first. We have to do this.
I think when the pandemic started, we were all very scared. You know, this was new to everybody, but it was a team effort, so everyone was going through the same experiences together. So it was nice to kind of have that support system that we all got through together.
I don't think I ever heard somebody saying, oh, that's not my job, you do it. Nothing. I think it was amazing. I think that made it easier with this entire process.
When it all came together, we've set up everything, and once that QC passed, we knew that we were ready. I called my CEO and said, we can flip the switch. We are now live with COVID-19 in-house.
COVID nursing is hard. You watch all these poor family members, you know, by themselves, and I mean, it's heart breaks your heart.
We're on the phone sometimes, you know, 6-10 times a day with these families, being a support system to them, letting them know how their family member is doing, because sometimes the family members are so sick they can't even talk on the phone.
We do whatever we need to do. If you walk in a room and you realize that it might be your mother, your sister there, and you're saying, wow, you know, they're dirty. You're not gonna leave. We have to help them because that's who we are. We're caregivers, we're healthcare workers. You know, we do this because we have compassion.
We're not afraid to work. There's no job me and her can do. You got good teamwork, job gonna done right. And you have to have compassion. If you don't have compassion, if it's just for the money, don't do it.
Compassionate is when you show patient that you're there for them, even when their family is not around. You're their second family.
I've had patients say, I'll always remember you. You said from the beginning, I'm your family while you're here, and I'll never forget you. And that is huge. That's why we do this.
Because there was a couple of months last year where it was just patients were just passing away every other day. We were losing one. And it's definitely tough, but it made me realize that this is exactly where I belong.
One of the patients, you know, I saw she is just literally going down, and I hold her hands and she smiled at me until her death. So I don't want my mind telling, okay, don't leave her alone. I did that.
To me, to hear the word I'm a hero is still something we're getting used to, and it still sounds a little funny because to me, in the back of my mind, I'm just here doing my job. And I mean, it is a good feeling, but yeah, it's still a little weird to hear.
I don't feel myself as a hero. I'm part of a team that's working and making people, trying to make people better and trying to get us through this.
I don't see myself as a hero. I don't see myself as a worker.
A lot of nurses and doctors are the ears. I'm not the ear. But other than that, if they want to say I'm an ear, hey, I will take it. Praise the Lord.
I came home and I was so upset after just a draining day at work. And there was this one girl on her bike that saw me in my scrubs. And she waved at me and said, "Thank you." And that just meant so much to me. And I will never, ever forget that.
Just having the ability to always test for COVID-19 or anything, it has been just our defining moment because we know that we have not failed the system. I will not be in a position where I was March 19th. Going forward, if this was to happen again, I have my playbook.
But this pandemic was different. It challenged us. But I feel like now we can deal with it. I'm a lot more confident today than I was back in March or April.
To me, it's been very rewarding being able to be with the patients. You have to realize, first time ever in the history of the world, if someone's sick in your family and you love them, you can't be with them. I can't even imagine what that would be like for the families and the patients. So it's an honor to be able to be with the patients, to hold their hand, to sit with them, to meet all their needs. You know, if they need someone to cry with, if they need someone to pray with, if they need someone just to listen, someone to be a liaison between the family and them, you know, it's just an honor to be able to do that.
It made me feel very special though, that I'm here and I can help, because that's what this job, I love it. I love to help people, I love to make them feel happy, and I love to be around all my coworkers. I love this hospital though. I have a purpose every morning that I get up.
It's the best feeling ever to be able to see a patient look at you and tell you, you saved my life. You helped me and make me feel so much better. And being able to walk out of the hospital after going through what they've been through, it's like the best feeling in the world.
I don't consider myself a hero. I love what I do my job. I was trained to do this, and definitely I take pride of doing the right thing for the patients. And it's my job, and that's what I came to do, and that's what I'm doing.
I wanted to thank everybody that works for Broward Health, from the people in facilities maintenance to the physicians to the administrative staff, for everything that you've done over these last 9-10 months with COVID. Putting yourselves at risk every day to help the community is nothing short of bravery and throwing yourselves into a fire that nobody expected. I want to thank the nurses in particular for doing this every day, the hours you've worked, the physicians for putting themselves at risk day in and day out, and everybody. Thank you so much. The community appreciates it, the board appreciates it, and take care of yourselves, be safe. Thank you.
I want to take this opportunity to thank the Broward Health team. Over the last 10 months, we have seen incredible pressure on each of you, each team member, whether you're a physician, a nurse, a respiratory therapist, someone that helps to keep the hospital clean and safe, whether you're corporate staff. It has been a tremendous year of pressure on each and every one of you. I want to thank you for the efforts to keep our community safe, healthy, and working. I also want to ask you to take care of yourselves. Make sure that you're taking time to get the rest that you need and able to do your job well. I want to challenge you to continue to serve our local community. The residents of Broward County need you right now. We are thankful for you, and I cannot tell you how much I deeply appreciate the efforts that we've seen from our Broward Health team. Thank you, thank you, thank you.
I just want to take this time to say thank you, and thank you. As someone who has lost 4 people during this period of time, I know that you are my real heroes. You were the ones that were there when it was needed. You were there for me, and you were there for the community, and could not have gotten through this period of time without you. So from a deep place in my heart, for all those families and friends of mine, and for families and friends out there, to my heroes, thank you for helping us and getting us through this pandemic.
For the past year, the people of Broward County, and in fact the people of the world, have experienced something we never envisioned. During that entire time, Broward Health, every single person associated with Broward Health, has kept the people of Broward County safe and secure and comfortable. I am so proud to be a part of Broward Health. I am so grateful to all of you who have done everything in your power to keep us safe, who have given of yourselves tirelessly with a commitment that we never anticipated, but we love you for. Thank you.
Ultimate Software, now known as UKG, has been a longtime supporter of Broward Health. We are so proud to continue our support, particularly this year, when we are honoring our healthcare heroes at Broward Health, who are always the backbone of health and safety in our community and are so deserving of all the recognition we can give you. Thank you to the outstanding healthcare heroes of Broward Health for guiding us through this pandemic and for your everyday acts of heroism that do not go unnoticed from your friends at UKG. Thank you.
We're all in this together. We're all in this together. We're all in this together.
We have something unbelievably special to share with everyone. A debut of an original song written in honor of all of our Broward healthcare heroes. The foundation has actually been working on this for months now, and it's my honor to be able to introduce this song, written and produced by Shelby Rassler. She's an accomplished musician who was born and raised in Broward County, and right now she's pursuing her master's in music composition at Juilliard. Shelby worked with the foundation and more than 30 high school students in South Florida to produce this magical piece. So sit back and enjoy.
Darkness around. Give us faith when it is hard to be found. And with hope and strength, our fears fly away. So with light and love, we just want to say thank you. matter what, we're not giving up. The stakes grow higher.
But the strength we desire is in you.
Yes, we know the hurt you have been through.
It's time that we lift up our voices and say, you are the reason we're here today.
You bring us hope when darkness surrounds.
Give us faith when it is hard to be found.
And with hope and strength, our fears fly away. So with light and love, we just want to say thank you.
We at Total Health Medical Centers and Care Management Resources salute you, our Broward Health healthcare heroes and staff. Your tireless dedication to our community. Many of you haven't even left the hospital yet to spend time with loved ones and family and friends. This dedication means so much to us. So on behalf of Total Health Medical Centers and Care Management Resources, we salute you and we stand proudly beside you as you take care of those we care about in our community. Thank you.
Let's take a minute to acknowledge our sponsors for their generous support of this tribute. What a beautiful song, and just imagine what it took to make that production happen. You can never underestimate the gift of music and its ability to bring us together. What a wonderful way to honor our healthcare heroes. To all of you, thank you for choosing to spend this time with us tonight. 2020 was a year that rocked the entire world, but as daily life changed dramatically, our brave healthcare workers continue to do what they've always done by showing up to their jobs and protecting our community, saving lives. Only through their courage, selflessness, and determination to help those in need have we managed to come through the most challenging period of our lifetime and be able to look to 2021 with optimism and hope. Thank you to all of our sponsors who have made this virtual event possible. Thank you to our viewers and to all of the generous members of our community and to everyone who's played a role in helping to make this virtual event happen. Thank you to everyone at Broward Health who continue to be our heroes. Many donations have already poured in tonight, and there is still time to donate. Just text the word HERO to 74121 to make your gift. It was an honor to serve as your host this evening. Please remember to stay safe by washing your hands, social distancing, and wearing a mask. Good night, everyone, and stay well.
Lives, day in and day out, a sacrifice led by compassion. Our community is strong forevermore. You've become our family, our friends, our loved ones, companions. More than we could ever ask for. 'Cause you bring us hope when darkness surrounds. Give us faith when it is hard to be found. And with hope and strength, our fears fly away. So with light and love, we just want to say we have saved all of our prayers for you, for all of the fears you have braved through. No matter what, we're not giving up. The stakes grow higher.
But the strength we desire is in you.
Yes, we know the hurt you have been through.
It's time that we lift up our voices and say, you are the reason we're here today.